Good afternoon, everyone. My name is Nancy DelMastro, Telehealth Project Manager at Adirondack Health Institute, and welcome to the March Telehealth Learning Collaborative hosted by the North Country Telehealth Partnership, a joint effort between AHI and Fort Drum Regional Health Planning Organization. As always, we are going to begin our meeting with some updates from our state agencies on all things telehealth regulation. I'm going to be providing the DOH and OMH updates as our representatives are unable to join us for today's meeting, and then I'll turn it over to Kelly Grace at OASAS to give some updates from OASAS. So for the Department of Health, Megan Procurum was able to provide us with some DOH updates. Emergency regulations for telehealth flexibilities are expected to be extended with an anticipated filing date of 3/22, so tomorrow. This regulatory extension will no longer tie the DOH emergency regulations to the end of the federal public health emergency. And DOH anticipates permanent telehealth regulations to be published on the 23rd of March, so Wednesday, with a 60-day comment period. So when those are released, I'll be sure to send those out to everyone, but also be on the lookout for those two items coming down the pipe tomorrow and Wednesday. From the Office of Mental Health, we have an update provided by Amy Smith. OMH's Commissioner's Waiver remains effective until June 5th, 2022, unless the federal public health emergency ends before, then as it is tied to the federal flexibilities. The second emergency regulation posting is good through mid-April. OMH is making some regulatory changes based on the public comments that they received, and they will need to repost for a 45-day period, and that will be happening in April. And OMH is finalizing the edits to their telehealth guidance document, which will be released upon final promulgation of the regulations. So look in April for those documents, and again, I'll be sure to share those when they are available online. If anyone has any questions about those, you could email me, pop those in the chat, and we can make sure that Amy and Megan receive those. At this time, I'll turn it over to Kelly to provide an OASAS update.
Hi everyone, this is Kelly Grace from OASAS. Pretty similar to the OMH update. Our regulations were actually adopted at the end of February, so our telehealth regulation is currently in effect. It's posted on our website. I think the date that it was published in the state register was February 23rd. We are in the final stages of getting our updated guidance all together. There's not like huge changes overall, but that will be getting posted and going out within the next probably week or so. And then we do still actually have our Commissioner's Waiver in effect, even though it's not super necessary since most of the COVID-related flexibilities were extended through the permanent telehealth regulations, but that is in effect until April 20th. And that's it.
Thank you, Kelly. Next, we have CMS updates. Tony, is there anything that you would be able to share with us today?
Oh, okay, thank you, Nancy. Yeah, basically, I found a section of the recent budget legislation that concerns Medicare telehealth, and excuse me, I can't really talk to the details until the agency, interprets them in terms of a regulation. But basically, what it looks like it does is it sets up a 151-day period that starts the day after the public health emergency ends. And during that 151-day period, the limitations on place of service where the telehealth individual, sits, the so-called originating site. There was like a geographic restriction to rural areas for most services, and also a restriction to healthcare as a place of service rather than the patient's home. Those application of those rules will be paused during that 151-day period. Another thing I noticed was that there's a requirement for mental health telehealth, telehealth for the purpose of diagnosis or treatment of a mental health disorder, and the rule requires that there be a in-person service provided within 6 months of the first telehealth service. The application of that rule will also be paused during that 151-day period. But as I say, there's a lot more in this. I passed the law along, and you can take a look at that. But when the notice of proposed rulemaking comes out, or the interim final rule with comment period comes out, I'll have more to present on the details of this. And that's all I have.
Thank you, Tony. And yes, I will be sure to provide links to the documents you were referring to. I'll provide that with the meeting notes so everyone could take a look. And again, if there were any questions regarding the state updates or the CMS updates that were just given, please place those in the Q&A or the chat, and we can address those after the presentation, or we can follow up after via email. With that being said, we'll move into our presentation for today, which is going to be given by me. So I'll go ahead and share the PowerPoint and get started. So as mentioned at the beginning of this call, and as many of you may know, my name is Nancy DelMastro, and I'm the Telehealth Project Manager at Adirondack Health Institute. And I'm going to be giving a presentation on the newly formed North Country Digital Inclusion Coalition. Quick agenda. We'll give some background on the National Digital Inclusion Alliance, which is the holder of the grant that we received to create our new coalition. We'll do a quick digital inclusion, digital equity level set for the group. We'll get into our newly formed North Country Digital Inclusion Coalition and our goals, and then we'll open it up to a discussion. And again, please, place any questions in the Q&A or chat, and we'll go through those as they pop up. So the National Digital Inclusion Alliance is an organization that advances digital equity by supporting community programs and equipping policymakers to act. The NDIA has created the grant opportunity that is funding the North Country Digital Inclusion Coalition. As I mentioned, their website has a lot of great informative guides, white papers, things of the like on digital inclusion and equity, coalition building for this type of work, and some great information about the advocacy they do in terms of all things digital inclusion. So I'll make sure that everyone has that link after the presentation. So what is digital inclusion? Digital inclusion is defined as the activities necessary to ensure that all individuals and communities, including those most disadvantaged, have access to and use of information and communication technologies. Includes 5 elements: affordable, robust broadband internet service, internet-enabled devices that meet the needs of the user, access to digital literacy training, quality technical support, and finally, applications and online content designed to enable and encourage self-sufficiency, participation, and collaboration. What is digital equity? That is defined as the condition in which all individuals and communities have the information technology capacity needed for full participation in our society, democracy, and economy. Digital equity is necessary for civic and cultural participation, employment, lifelong learning, and access to essential services. And in our focus, telehealth access. So some background on the funding. The New York Digital Inclusion Fund is designed to support innovative partnership models that accelerate digital inclusion across New York State and recognizes the need for affordable, high-speed internet devices and digital skills. It's managed by the National Digital Inclusion Alliance and funded by Schmidt Futures, a philanthropic initiative founded by Eric and Wendy Schmidt. So we received a Digital Inclusion Coalition Planning Grant. That funding has the goal to increase the number of digital inclusion partnerships across communities throughout the state to advance digital equity by addressing those barriers to digital inclusion. Specifically, the funds are used for and what we're doing. We're forming a coalition by bringing together diverse groups of digital inclusion stakeholders. We're researching and defining community digital inclusion needs with the goal to design an implementation plan to provide comprehensive solutions in anticipation for funding at the state level eventually. And we want to overall build those relationships with local and state-based stakeholders for all things digital inclusion, including municipal and state government, education departments, state library, national organizations, and healthcare organizations as well. So some of the coalition activities. So we're forming the coalition with a diverse group of stakeholders. In a couple slides, I'll get into some of our members of the North Country Digital Inclusion Coalition. We're really trying to support and bring together these groups to talk about, what collaborative efforts or opportunities are available, research the needs, and we'll talk about how we plan to do that. And we're really trying to design a plan to provide those local solutions to the North Country. And looking at this nice graphic that the NDIA created, I'd say that the North Country Digital Inclusion Coalition is probably about stage 2. We're really building the coalition at this stage. This is a planning grant. We started this coalition from the ground up. This wasn't something that had already existed in our region. So we continue to recruit and gain interest from our partners and other folks within the region to create that coalition with great collaboration opportunities. So when we saw this opportunity come through, we figured it was the perfect opportunity for the North Country Telehealth Partnership to go after. We're leveraging the North Country Telehealth Partnership, who has this already great relationship with our healthcare partners and community-based organizations throughout the North Country, to really dive deep now and look specifically at the digital inclusion needs, and specifically looking at how those affect telehealth access in our region. So some coalition member organizations to date. So we're convening a wide range of coalition members to create this group. We're leveraging relationships we have from the partnership. So our healthcare partners, of course, community organizations. We're excited to have some representation from higher education. I'm excited to see the Northern New York Library System, who does a lot with digital literacy training. Senior Planet, Older Adult Technology Services, does a lot of great technology training for the aging population, and many more. And as mentioned, we are always looking to grow this coalition. We've only had one initial meeting this far. So we're really looking to host a group that represents the North Country in all facets to talk about all things digital and inclusion and how to reach digital equity in the North Country. So some of our goals. So of course, we're utilizing the North Country Telehealth Partnership, and we're looking at digital inclusion and digital equity from a telehealth lens. So we are in the process of developing a survey instrument or two to determine the community needs and what specific barriers to telehealth access still remain, or what's really affecting successful telehealth programs in the North Country. We're creating a partner-facing survey that we'll be disseminating to our healthcare partners in the region to see, what are the barriers that our providers are facing in terms of their practices and what they're doing in terms of telehealth, as well as a survey for community members on telehealth accessibility from the patient or community member perspective. After disseminating those surveys, we're hoping that those results can inform the creation of an action plan on how the coalition can work to provide some regional solutions and how we can, bolster a stronger telehealth network within our region and for our communities. Again, mention the goal. We're really trying to increase telehealth equity in the North Country and identify the largest gaps to digital inclusion. Is it broadband access? Do our community members lack access to the technology needed to successfully have a telehealth visit? Do they not really understand how to utilize this digital health and telehealth access? Is it a digital literacy need? Or maybe, isn't those top three? Maybe there's something else that we're missing, and we're really hoping that the surveys and as well as the coalition meetings and bringing together this diverse group of stakeholders can help us identify the key needs in terms of telehealth in our region and how we can potentially work together as a coalition to address those. That was a quick overview of what we're trying to do with this new North Country Digital Inclusion Coalition. As mentioned, I'll provide some further information and links to the National Digital Inclusion Alliance. It's a really great resource. They do some awesome advocacy work and educational initiatives. But at this point, I'd like to open it up to discussion. I think that, to really identify the needs and to work through things, we need to have open dialogue and talk about what you all think the barriers are in our region and beyond. Maybe you're not in the North Country, that's totally fine. I think telehealth access, but we could talk about it in terms of New York, the region, nationally. What can we do to assess these needs? So I have a couple questions on this slide. I'll allow everyone to unmute if we want to have an open dialogue and chat through some of these. We could also add some of the comments that anyone has into the chat, whatever anyone's comfortable with. But let's start with the first question. What do you think the largest barriers to accessing telehealth are in the communities you serve? I'm going to go ahead and I don't know if everyone has the ability to. I don't want to click unmute and everyone will then unmute. I'm going to make everyone a panelist and then that'll give you the opportunity to unmute. I'm also going to be monitoring the chat here. The first note that we got, which, I think is probably what a lot of people are thinking: lack of high quality broadband, lack of proper equipment, and lack of Wi-Fi. That's a great point, Michelle. And those are all points that we discussed in our first coalition meeting that were brought up by probably almost all of our coalition members, and we span 11 counties, but we do see a lot of the same issues, being the broadband connectivity and community members not having that equipment. The largest barriers we see to face it is connectivity and tech on the client side. That's a great point too. I think that a lot of times we don't really focus on the digital literacy trainings, and I think that's something that could be a really nice way to tackle these issues as a coalition. Lack of infrastructure to support broadband to everyone who wants it. Very true. I know there's a lot of advocacy and a lot of work that are going into broadband infrastructure right now within the state and nationally. And I'm very happy to see that there's quite a bit of momentum. And I think at our regional level, something really important is for all of us to advocate at the local level to try to get our voices heard and bring some much needed focus to the North Country. Not being able to understand and properly use technology. Yeah, I really think that digital literacy, along with health literacy, I think those two go hand in hand, of course, for telehealth access. And I think those are really great points that we can try to maybe create user guides or educational opportunities that focus on community members' educational opportunities. Privacy concerns within homes and the workplace. That's another great point. Finding one consistent technology solution that can impact all patients equally. That is a really awesome point. As telehealth booms and continues to grow, especially since the onset of the pandemic, the technology opportunities, the different vendors, the different solutions are endless. And how can a community member go to multiple providers and have to deal with a different solution for each visit? It definitely can cause some confusion, and it might deter some folks from using telehealth, honestly. So really great. Really awesome point from Todd Young of UVM, wondering how much language is a barrier in the North Country. In Vermont, we have a lot of new Americans with a wide variety of languages. This is very true, and this is something that we have put into those two surveys that we will be disseminating. We're asking, is a language interpretation service needed to be embedded within a telehealth tool to ensure that English as a second language patients or folks that maybe need that service have access to it. So that's something we are really interested in seeing the results on, to see how it really affects the North Country. Closed captioning for hearing impairments. Yes, we're actually also, we just recently added some information and a question in about individuals with various disabilities and how different disabilities may affect the ability to successfully utilize telehealth, whether it be, hearing impairments, visual impairments, and more, and how caregivers also may need additional support. These are all really awesome thoughts. Looking at the other questions, I know, people probably already have put some thoughts in regarding the second and third, but, thinking about digital equity, that's a pretty high level, it's a complex term. it involves a lot of key activities to reach that equitable state. What are the main digital inclusion drivers that influence telehealth? You know, I think that broadband access is probably up on the list for everyone. And then the digital literacy trainings as well. But if anyone has any other ideas, you know, I want to think outside of the box here and try to see if there is anything else that we should be focusing in on for our 2 surveys, and what else we could potentially focus on that may not be those more obvious choices. Not seeing anything else pop in yet, but you know, looking on to the next question as well, how can coalitions work towards tangible improvements in the digital inclusion space? And these are a lot of challenging, you know, barriers. What sort of activities do you think a coalition like the North Country Digital Inclusion Coalition, what can we do to try to move that needle to really boost that access and availability of telehealth to make sure that there is that equitable access in our region? Great point, Todd. I think it always comes down to providers offering it as an option to patients. Very true. And, you know, we did see obviously a huge uptick with COVID, but, you know, we're seeing some of those utilization numbers drop now, and we want to ensure that the access, you know, stays at an appropriate level. And we want to make sure that our community members that want to utilize telehealth have that ability to do so. Mobile training labs, that's a really interesting concept, Bob, that, you know, maybe we'll talk about that at a future meeting, but I really like that thought too. Make the health equipment more readily accessible to providers. Very true. Telehealth equipment, you know, can be daunting. It could be expensive, and, you know, of course it depends on the what the telehealth is being used for, but for a large telehealth cart for a health system, not always as accessible to all providers. Very true, Michelle. Unfortunately, the population that could benefit the most to use telehealth services are elderly who do not have the understanding or technology to access. That's a great point, Susan. And, you know, having groups like Senior Planet and the Older Adults Technology Services organization on the coalition, I think will really help to try to address the needs of older adults in our aging population in the North Country, especially since the North Country does have a very high percentage of older adults. There are some really interesting initiatives that are happening and that are geared towards older adults, and I think that they're maybe just not fully known to our population. So maybe that's something that we'll have to do. We'll make sure that those opportunities are widely communicated and shared with our partners.
Nancy?
Yep.
Is it okay with you if we actually jump in verbally and not just through the
Yes,
chat?
of course.
Okay, I thought so. I was just, maybe I'll start a trend. So my name is Crystal and I'm from OFA in Lewis County. And when it comes to older adults and telehealth, one of the things that I've been thinking about a lot is trying to look at this issue through like a cultural competency lens. And I think it's important for us to consider as professionals that not everyone wants to have their healthcare delivered through telehealth, and that I think to some degree we should be sensitive to that and think about providing access to folks who are interested in receiving their healthcare that way, and not encouraging all people to utilize this resource, because I don't think that that's culturally, I think that that's out of sync with what some people want and need, and that it's important to be mindful of that.
That's a great point. Thank you. And thank you for unmuting. I figure everyone's sick of hearing me speak this entire time. So thanks, Crystal. And that's a great point. I totally agree. By no means do we want to force telehealth on anyone, if it is the safest option due to the pandemic or in other, cases, so be it. But, I think we just want to ensure that the opportunity is there for everyone. But your thoughts are definitely heard. Thank you. See a lot in the chat as well. Publishing information about opportunities to obtain adequate technology, including assistive technology. Publishing information about hotspots, educate providers about obligations under the Americans with Disabilities Act to accommodate patients, and publishing providers of interpretation services. Great points, Catherine. I love all those, and I think that it's definitely something that the coalition can work towards, publishing some of these guides, some of this information, so it's easily accessible to our providers, our community members, community leaders in other sectors other than healthcare, to really share this information widely in the communities. Ray says, policy changes to ensure sustainability. Providers will only use and continue to expand platform usage if it's sustainable. Great point. I think that's something we've talked about since before the pandemic, ensuring telehealth sustainability and the sustainability of those programs is key and will continue to be such a driver. Agreed. There should be a mapping to see where there are voids in partnership. I consistently find absent Hamilton County. That's a good point too, Nancy. I know that there are plenty of mapping efforts that are currently happening at the county level, actually, in terms of broadband access. So that's something that I'll locate some of those links to different initiatives and provide those with the meeting notes. Continued support of transportation to in-person appointments to support telehealth guidelines. Great point, Lori. And that's something I think we also maybe don't talk about, but yeah, that sort of meeting the middle of in-person appointments and the supporting of telehealth guidelines and looking at those in the same respect. Working with providers to offer intro sessions to get familiar with telehealth apps providers are using. That's another great idea. For providers that are doing surveys to get feedback on their use of telehealth, work with them to phrase questions appropriately to get the data we are interested in. That's very true too. I think that sometimes surveys can be a little daunting or confusing to those who are utilizing them, and making sure that all the messaging regarding telehealth is very clear and to ensure that we are capturing all relevant data is very important. Creating telehealth clinical treatment guidelines for providers so they will feel more comfortable using the platform to provide patient care. That is definitely something that we can assist with as well. I think that's a great idea. Just want to invite anyone else, if anyone wants to unmute, share their thoughts, feel free. Support parity between reimbursement for in-person and telehealth visits to acknowledge that one type isn't necessarily the best at any given time for any given reason. Yes, payment parity is always something we're very passionate about, and we agree wholeheartedly. thank you all so much for your participation in this. I know all of these thoughts that have been provided in the chat and those Crystal who spoke out. We really appreciate it, and this will definitely help us. We'll bring these to our coalition meeting, our next meeting in end of March, as definitely some great food for thought. Marketing telehealth as a convenient care option. Yeah, I think that, sometimes the marketing aspect is overlooked. From our end, some of the us that are more clinical, we look at telehealth in one light, but from the community member's perspective and how telehealth is marketed and communicated to community members, I think that is super important. And it might sometimes be a little too clinical or maybe a little high level. I think some people assume at this point, after 2 years of COVID, that everyone understands telehealth. Everyone's done it at this point. But that's not the case, and I think we have to ensure that all of our marketing and our messaging is clear and also, preliminary. We have to get some, telehealth 101 out there as well as we continue utilizing telehealth for sure.
Tony Gemrosi from CMS. Some of the questions that our agency are dealing with is what services are appropriate for telehealth and what aren't, and how to prevent fraud.
Great points, Tony. That is very helpful to hear what you are all hearing, from your respective agencies as well. Any other final thoughts? So we'll continue to update this group on, progress with the North Country Digital Inclusion Coalition. A lot of our participants today actually are a part of the coalition, which is awesome to see. But we'll also, I invite everyone to, if you're interested in joining the coalition or at least getting on my contact list for that, to get, notes from those meetings, hear what we're talking about within those sessions. And I'll be creating like a Teams group so different coalition members can share organizational updates, different advocacy efforts, whether it be, from the broadband lens, or different, FCC opportunities, for example. I invite anyone to, send me your emails if you're interested in joining us. Please send anything my way, and we'll be happy to include you. At this point, I'll move on just to provide some further updates. I'm just going to share a different screen quickly. All right. So just some various updates and some upcoming educational opportunities. So this first one goes back to what Tony was mentioning. So the Consolidated Appropriations Act was signed on March 16. And I found a National Law Review link that describes the telehealth flexibilities that are included in that. So I'll make sure everyone has that link to review at their leisure. regarding, you know, what was included in that and how it affects telehealth. Last week, a press release was released on the Affordable Connectivity Program, and the governor announced 100,000 families have joined the federal broadband affordability program from our state, which is very exciting. It's a great opportunity for more folks to get that affordable access to broadband. There's a notice of proposed rule from the FCC, and there's a open comment period right now going on. So the FCC is making revisions to the Rural Healthcare Telecommunications Program rules to ensure that rural healthcare providers receive the funding necessary for the broadband and telecommunications services they need to successfully provide their healthcare services. So I have a link here to those proposed changes, and the comment, you know, all that link has all the information, instructions on, you know, providing any comments you may have on those proposed rules. And then, you know, any other thoughts you may have on increasing the speed of those funding commitments from the FCC. And those comments are due by April 14. And again, you'll have this link to that opportunity when I send this out. Then there's some upcoming educational webinars and events that I would like to share. The Extelligent Telehealth 22 Virtual Summit is happening tomorrow and Wednesday. There's quite a few interesting presentations that are on their agenda. You could sign up for just a few of those or all of them. I already have a bunch on my calendar. There's another, one of the telehealth resource centers is hosting a webinar on access and accessibility for telehealth barriers for patients with disabilities. This might be a really great one, especially since a lot of the comments that were brought up today sort of revolved around access for telehealth for those that have disabilities. And there's an ATA webinar coming up for telehealth for rural communities. At AHI, our Adirondack Rural Health Network is hosting an educational series that we're helping out with. Our first session is on April 5th from 10 to 11. It's Tuesday, and the presentation is titled The Straw That Stirs the Drink, How and Why Face-to-Face and Telehealth Tobacco Treatment Can Empower Virtually All Medical Programs. We're really excited to host this event. It's really interesting tobacco cessation program that utilizes some RPM as well as some in-person cessation tools. So hopefully we'll see you all there, and registration is included, and I'm also going to be, you know, blasting out that registration with a flyer that you may see in the next couple of days. Another Telehealth Resource Center webinar, Innovation and Integration of Telehealth into Population Health. Another topic we're really excited about sort of delving into even further on our end as well, you know, integrating telehealth and population health and seeing that collaboration in a lot of different programs. And finally, the ATA Annual Conference and Expo that's happening May 1st to 3rd. I think it's hybrid. They have in-person availability as well as virtual options, which we like to see. So all of these links you'll have in the notes, as well as the recording that I will be sharing in the next couple of days. I'm just gonna stop sharing quickly so I can see the chat one last time. I'm not seeing anything further from our initial discussions, but I'm making sure that I'm copying everything from this chat. And again, I really appreciate everyone's discussion and everyone's thoughts on all things digital inclusion. Again, I'll keep everyone in the loop as we continue to strengthen this work with the Digital Inclusion Coalition in our region. And you'll see a couple of emails coming out from me in the next couple of days with the notes, the YouTube link for this recording if you want to, you know, circle back on anything, and some further events coming up. So I thank you all for joining us, and we all get a couple minutes back in our day. We'll end a little bit early. So thank you all and have a great day.